Anti-Tragus Piercing. The pros, the cons, the advantages, disadvantages, 5 of each coming up right now. For those that are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I'm the owner and operator of the Axiom Body Piercing Studio located in Des Moines, Iowa. Inside Skin Kitchen Tattoo. When I speak to you about these things, I'm talking to you from a level of expertise of having performed the piercing multiple times, probably thousands of times, over the last 25 or so years, in helping people through the healing process and seeing how they healed as that healing progressed. So, let's get into it. I'm going to go through 5 advantages, 5 disadvantages, 5 pros, 5 cons, starting with the pros, the advantages, the half full part. Number 1, this is a fairly rare piercing. It is not a common piercing, though it seems to be building in a little bit of interest over the last, I'd say 3 or 4 months. It's not one of those piercings that most people have. It's going to be unusual, it's going to be unique, so if you're one of those people that's looking for something that's a little bit different than what your average piercing is, this is a good choice for you. Number 2, this is a piercing that fits well into the anatomy and in the shape of the ear. In fact, it can be done in a way where it looks like it almost folds into that little crevice there at the back of the lobe, or even almost a vertical or horizontal, depending on what your anatomy is. It kind of fits into that flow, and a piercer with the right expertise can look at the shape of the area and know exactly what's going to work best as far as placement to display that piercing. Number 3, heals fairly rapidly compared to other piercings. You're usually looking at a healing period of 8 to 12 weeks. And I will go into the details of what I suggest at the end, so we'll leave it at that, and also some of the disadvantages of the healing time. Number 5, the last of the advantages. You can wear different types of jewelry in this, different shapes. The most common ones would be barbells, labret studs, curved barbells, or even rings in some cases where it fits tight and comfortable to the ear. So now let's get into the disadvantages, the cons. Number 1, the piercing has to be pierced with a piece of jewelry that is oversized or too long for the actual piercing to fit comfortably. Meaning we have to allow that extra space, usually because we do this with a barbell which has limited expanse. They have to be pierced with a piece of jewelry that's basically too large for the piercing. That increases the likelihood of contact with clothing, bedding, towels, sleeping, headphones, headgear, helmets, etc. So it's really important to isolate this piercing and keep things away from it. You will probably have to downsize to a shorter barbell or labret stud or switch jewelry when the piercing is healed. Number 2, you are limited on the type of jewelry that you can be pierced with initially. We pretty much want, depending on your anatomy, either a curved barbell, straight barbell, or a labret stud to limit the amount of movement of that jewelry. I do not advise doing this with rings. I have had clients heal it out with rings in the past. It was a little bit more problematic than, say, a straight or curved barbell or post-style jewelry. Number 3, can go through various different stages of grumpiness. For those that are new to piercing, what grumpiness means is these periods of time where it's sore and tender and seems like it has issues. This is one of those piercings that is prone to that and will take a little extra babying and extra care and isolation, etc., to make sure that you don't have issues. Number 4, highly dependent upon your anatomy. This piercing definitely needs 2 sides. If you kind of take your index finger and you stick it downward to the base of your ear, just above your lobe, and you pinch down, what we're piercing is that tissue. On some people, it's almost straight up and down or at a slight angle. Other people, it will kind of curve downward like this, like mine does. It really depends on your anatomy because we do not want to cause friction or pull up too much on the lobe, that loose tissue, or cause the tissue to kind of roll, and then you end up with a piercing that isn't done deep enough into the tissue and will migrate or reject. So it's very specific. It's something I would consider this a more advanced piercing. You do need to find somebody that knows what they're talking about, what they're doing, and has a lot of experience doing this particular piercing. Number 5, this is where I kind of go through what I would normally tell you if you came into my studio and asked to get this piercing, to give you kind of enough information to make an educated decision of whether or not this piercing is right for you. First thing, average healing time, like I said earlier, is roughly about 8 to 12 weeks, during which time you need to commit to doing hot compresses or soaks for 10 minutes twice daily with warm water and sea salt. Also, cleaning in the shower using an antimicrobial or germicidal soap at least once a day, twice if you feel like it's been contaminated. Cross-contamination prevention. Common sense things your mother should have probably taught you. Wash your hands before you handle it. The only time you have any contact with the piercing is when you're cleaning it or doing compresses. The rest of the time, leave it alone. Also, keep everybody else's germy little fingers away from it. No oral contact or exchanging of bodily fluids on you around the piercing, including your own saliva. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned on a regular basis. Keep pets away from it. Do not let them sleep in the bed with you. Do not submerge the piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. You also want to isolate the piercing. You do not want to sleep on it. Wear any type of protective gear, earbuds, helmets, anything, headphones that may cover up the piercing during the healing process. You also want to make sure anything that comes in contact with it is cleaned on a regular basis. Number one, I would 100% avoid any contact with cell phones or mobile phones, especially if they have a glass surface, which is 99% of all phones right now. There is a lot of contaminants on there that you don't even want to know about, or you'd never put it close to your mouth again. Also, objects that most people don't think about, things like sunglasses, regular glasses, also earbuds, anything that's going to contact the area needs to be cleaned on a regular basis because stuff travels. If you use anything that comes out of a spray can or squirt bottle in your hair, you want to shield it with a folded up paper towel. You're going to want to do the same thing if you go to the beautician. I'm always leery of that bottle of water they use to dampen your hair as they trim it. What exactly is in there when it was changed last? Anyway. Any activity that's going to add pressure or confinement or anything that's going to have constant contact with the piercing during the healing process should be avoided if you are in any type of competitive sports or competitive hobbies in which you are required to remove the jewelry while competing or practicing or what have you. This is not a piercing for you. I don't usually suggest that if you're actively going to be involved in anything like that within the next year that you don't get pierced. The problem is that even though the piercing may be healed, removing the jewelry, even for short periods of time, if you're a healthy individual, is probably going to cause the piercing to start to shrink and close. And the issue with that is you're putting kind of unclean jewelry back in there, you could possibly disrupt or tear or cause damage to the piercing itself, and then you're starting the healing process all over again, but this time, because that jewelry wasn't sterile when you put it in there, you may have an infection. So that's something to consider. You really want to wait until you absolutely have a break from that type of activity, and consider whether or not you can, or ask whether or not you can wear a retainer while doing that activity. So that pretty much sums it up. 5 advantages, 5 disadvantages of getting an anti-tragus piercing. I hope that you learned enough information today that you can have an educated decision on whether or not this piercing is right for you, and also a few talking points when you go in and talk to your piercer to make sure that they are on the same boat, or the same boat, or is it bus? Boat, bus? I don't know. Anyway, are as knowledgeable as you are. Be surprised, and ask them if something contradicted from what I told you. Have a discussion with them. Ask them why they feel it's that way. If you disagreed with anything I had to say, or you agreed with it, or you would like additional information about something I talked about in this video, please leave a comment. I do answer them whenever I can, and will continue to do that until there's so many of them I can't do it anymore. Then I'll hire somebody to do it. Just a bunch of monkeys typing on keyboards, maybe. I don't know. I mean, a gibberish comment has got to be as good as a regular comment, right? Other than that, if you like the video, give us a thumbs up. That'll let you know that you appreciate what I'm doing here and here on the channel. Also, if you would like to see future videos on piercing and tattoos, please subscribe. If you want to make sure that you know every time we post a video, hit the notification bell. Till next time, you have a good day and good luck with your piercings. And if you're in the Des Moines, Iowa area, I hope to see you for your piercing needs in the future.